Good morning, everybody. I am Maram El Gazzar, lecturer of Diagnostic and Intervention Radiology, Banha University. Today we will, today we will talk about tracheobronchial imaging and AI application. There are many imaging modalities for tracheobronchial imaging. There are X-ray for initial imaging modality, CT for more detailed information, MRI for more soft tissue characterization, and advanced techniques like virtual bronchoscopy and AI application. Chest X-ray is the most common first method to image the airways. Specific neck X-ray with lateral views are used for upper airway problems as well. X-ray applications in imaging the airways. A chest X-ray can visualize large airways like trachea and bronchi as we see here, helping spot narrowing, deviation, or blocking of the trachea, useful for diagnosing serious conditions like croup in children with a steeple sign as it obvious here. Lateral neck X-rays can assess the soft palate, epiglottis, hypopharynx, and larynx. As obvious in the picture, there is lateral X-ray of the neck with notable obvious nasopharynx, oropharynx, and hypopharynx. It is useful for diagnosing foreign body aspirations or swelling like epiglottitis. In such image, we see the foreign body aspirated on the chest X-ray posterior anterior view and more obvious on the lateral views. While here it is some brain sign of epiglottitis. Limitations of X-ray in imaging the airways. It has many limitations like poor soft tissue characterization. This makes it difficult to detect subtle abnormalities in the airway wall, such as inflammation or early stage tumors. Limited detection of small or distal airway issues. More advanced techniques like CT or bronchoscopy is more often required for detailed assessment of these areas. So now we will talk about the CT for more detailed information. CT is the gold standard for imaging the airway. Multi-detector CT offer high resolution thin slices for detailed 3D visualization of the tracheobronchial tree, as seen on the CT scan with sagittary formatted images, which noted nasopharynx, oropharynx, and hypopharynx, and the larynx was subdivided into supraglottic, glottic, and subglottic larynx, and the lateral views of the trachea. Applications of multi-detector CT in tracheobronchial imaging. It is helpful in assessing issues like wall thickening, dilatation, stenosis, or air trapping. So, help in diagnosing diseases such as COPD, cystic fibrosis, and tracheobronchomalacia. It's also helpful in diagnosing foreign body aspiration and mural masses and nodules. This is a CT scan of the chest with pulmonary window, showing marked stenosis of the trachea, and more obvious on the coronary formatted images. It's also helpful in assessing the length of the stenotic area, so help the surgeon in case of resection and anastomosis to save the patient's life. It is a CT scan of the chest with axial views, pulmonary window showing lung emphysema with panlobular emphysema, paraseptal, and centroacinar. A case of tracheobronchomalacia, the lower views are the inspiratory films. So with expiratory films, it's more obvious that there is collapse of the trachea and right main bronchus mainly. So as there is weakness of the wall, it is diagnostic of tracheobronchomalacia. It is a case of cystic fibrosis, and this image helps us to know that the CT is actually better than the chest X-ray for more characterization, as CT show markedly dilated bronchi, some with air fluid levels, as it is obvious here, while the chest X-ray only show a cystic lesion in the right lower lobe with minimal air fluid level. It is another example of cystic bronchiectasis, where coronary formatted images of the CT scan of the chest with pulmonary windows showing a markedly dilated bronchi with trach-like bronchiectasis and cystic bronchiectasis. CT is also helpful in imaging the upper airways. CT scans are crucial for detailed upper airway imaging, offering high resolution. It can assess issues like obstruction, trauma, like laryngeal fracture, tumors, laryngioceal inflammation, epiglottitis, and structural changes with airway modeling. It is a coronal reformatted images of the CT scan of the neck showing internal and external laryngeal. Limitation of CT in imaging the airways, radiation exposure, so it is not ideal in pregnancy and pediatric age group, while inability to see mucosal folding, which affects the wall thickness measurement, and respiratory motions, long movement during breathing causes artifacts, making constant imaging difficult, especially in infants. Now we will talk about the MRI, which give more soft tissue characterization. Key advantages of MRI for airway imaging: it offers radiation-free, safer for repeated scans, especially in children. It is ideal for assessing airway wall thickening, like in bronchiectasis, or vascular compression, especially in the kids. Superior tissue contrast, which can differentiate the airway wall, like inflammation or mucus, from surrounding tissues better than the CT. It helps also to give functional assessment. Dynamic scene images show collapse using hyperpolarized gas MRI visualization to visualize the ventilation perfusion defects, reveal airway obstruction or dysfunction. It is an example of pulmonary artery sling of the MRI with axial view, showing that the left pulmonary artery arising from the right pulmonary artery and passing posterior to the trachea. It is another example of the MRI T2 images, axial and sagittal views, showing a posterior tracheal wall soft tissue lesion encroaching on the airway lumen, causing marked narrowing. Limitations of MRI in tracheobronchial imaging. It has lower spatial resolution. CT is better for visualization small airways down to the subsegmental level, while non-contrast MRI typically shows down to the fourth order branches. Motion sensitivity, it requires patient cooperation or advanced techniques to minimize respiratory and cardiac motion artifacts. And now we will talk about advanced techniques like virtual bronchoscopy and AI application. CT virtual bronchoscopy. Multi-detector CT virtual bronchoscopy represents one of the most recent developments in 3D visualization techniques, which allows a 3D evaluation of the respiratory airways. In comparison with real bronchoscopy, virtual bronchoscopy has some advantage. It is a non-invasive procedure that can visualize areas inaccessible to the flexible bronchoscopy. In children and in some indications, virtual bronchoscopy can replace fiber optic bronchoscopy when this technique is considered too invasive for children. Applications of virtual bronchoscopy, it is able to evaluate bronchial stenosis and obstruction caused by either endoluminal pathology, tumor, mucus, or foreign bodies, and external compression by anatomical structures, as we said, pulmonary artery sling, tumors, or lymph nodes. It can be helpful in preoperative planning of stent placement and postoperative assessment in case of lobectomy or section anastomosis. Evaluate anatomical malformation and bronchial variation. Steps of virtual bronchoscopy: we take a CT chest with volume rendering, obtain 3D airway trees, extraluminal and endoluminal surfaces, select region of interest. Automatic method, define a procedure plan consisting of airway navigation routes leading to each row. The live bronchoscopy video source and saved videos. Limitations of virtual bronchoscopy. It is current virtual bronchoscopy has some limitations like high cost, lack of visual aids beyond simulated endoscopic views, difficulty in performing interactive anatomic exploration, and use of surface rendering instead of volume rendering. AI application in imaging the tracheobronchial tree. It is primarily used as a supportive tool to enhance diagnostic accuracy, automate complex measurements, and improve clinical workflow efficiency. AI algorithm analyze the chest X-ray and CT scan to help radiologists and clinicians detect and manage the various airway conditions. Some of its application, it helps in airway nodules and tumor detection. Deep learning systems are being developed and tested to detect subtle or easily overlooked benign and malignant airway nodules on chest CT scan with high sensitivity. Foreign body aspiration, AI models have shown a significantly higher success rate in detecting radiolucent foreign bodies in the airway compared to the human radiologists alone. Quantitative analysis, AI automates the time-consuming process of measuring and analyzing anatomical structure and disease extent. Airway segmentation and 3D reconstruction. Algorithm can automatically segment the complex 3D structure of the bronchial tree from CT and cone beam CT, providing objective measurement of the airway diameter, wall thickness, and volume in diseases like cystic fibrosis and COPD. Emphysema and air trapping quantification. AI quantifies the extent of emphysema and air trapping on chest CT scan, helping to stage the severity of chronic obstructive pulmonary disease and predict disease progression. As we see here in such a model, coronal images showing the green color of the affected emphysema within the case of COPD. And thank you.
Thank you very much, Dr. Maram, for your presentation. And